Just because you don't have any medical experience doesn't mean you're not going to get your first Newgrad RN job. In fact, I would argue that your most important, valuable experience as a nursing student and new graduate nurse is your clinical experience. Your clinical experience is the most relevant experience you have. I don't care what past experience you might have. You might be thinking, well, I was a CNA for 10 years. That's really valuable experience that you should leverage. However, as a CNA, you're not passing medications. You're not learning how to put in IVs. You're not learning how to talk to doctors. You're not learning how to chart. And those are all skills that you're learning as a student in clinicals. And because of that, you're going to use those clinical experiences to answer a majority of the nursing questions they're going to ask you during your interview. Tell us about a time you had to advocate for a patient. Tell us about the most difficult patient you had to take care of. Tell us about a time you had to go above and beyond for a patient. All of that's going to come from your clinical experience. And again, I'm not saying your time as a CNA, as an ER tech, as an EMT, all of that is incredible experience that you can leverage and use to answer these questions, but a majority should be answered from your time as a nursing student during clinicals. So just because you don't have any medical experience, that doesn't mean that you won't get a nursing job. You will get a nursing job. You just need to learn how to optimize and how to tell a proper story from the time you've had in clinicals. That's how you're going to get your first nursing job.